Reperfusion injury, the paradoxical damage caused when blood flow is restored to previously ischemic tissue, remains one of the most significant hurdles in cardiology and stroke management. While timely reperfusion is the gold standard for saving tissue, the sudden influx of oxygen and inflammatory cells can trigger a secondary wave of destruction. When blood flow returns, several toxic processes can occur simultaneously. A massive burst of reactive oxygen species damages cell membranes and DNA. Ischemia disrupts ion pumps, leading to an influx of calcium that can cause hypercontraction and cell death. Neutrophils can rush to the site, sticking to the capillary walls and releasing inflammatory cytokines. Mitochondria, the powerhouses of the cell, fail, often triggering programmed cell death or apoptosis. Research on reducing reperfusion injury has shifted from simple mechanical fixes, as was offered in the Dynamite trial, to complex pharmacological and conditioning strategies. Dynamite 3 defer, that is deferred stenting, possibility that immediate stenting may cause distal embolization, microvascular damage, and flow disturbances leading to adverse outcome. 10-year follow-up results published in 2025 show that while deferring stent didn't reduce overall mortality, it significantly reduced hospitalization for heart failure in STEMI patients. Remote ischemic conditioning combined with local post-conditioning, that is, intermittent cuff occlusion of brachial artery for about 5 minutes with release for 5 minutes at hospital presentation, and low pressure balloon occlusion after angioplasty, that is for 30 seconds each. These are remote ischemic conditioning and post-conditioning. Ongoing trial, estimated completion in 2030, is testing this hypothesis in high-risk STEMI patients. Clinical efficacy of extracorporeal cardiac shockwave therapy in patients with ischemia reperfusion injury that uses shear stress and cavitation, that is microbubble formation, to trigger the release of angiogenic factors like vascular endothelial growth factor VEGF and inhibit apoptosis and oxidative stress. The ongoing trial is investigating if extracorporeal cardiac shockwave therapy can improve coronary microcirculation and reduce reperfusion damage. FIRE sub-study with fibrin peptide FX06 or matching placebo given as an intravenous bolus at reperfusion showed that FX06 significantly reduced infarct size at 4 months in the early presenters and in those with collaterals. A 2025 review highlights smart nanomaterials like nanoparticles that can deliver drugs directly to the ischemic zone, overcoming the low bioavailability of traditional medications. Ultrasound-targeted microbubble destruction technique uses microbubbles that burst under ultrasound to deliver specific inhibitors like NLRP3 inflazome blockers exactly where the heart is injured.